Charlie Baker, and other state officials are speaking about the coronavirus and giving the latest update. Let's listen in.
For their cooperation and community spirit as we all deal with COVID-19. It is a profoundly challenging time for all of us, unlike anything I've ever been a part of. But the many acts of kindness, compassion, bravery, and creativity that we hear every day remind us that you are all very special. We have several announcements and updates we'd like to share with you today. We continue to make progress in expanding our testing apparatus, which is a critical part of identifying and stopping the spread of the virus. Yesterday, we reported nearly 20,000 people have been tested, and we expect to continue to increase the number of tests completed every single day. This time last week, we had completed about 2,600 tests. Last week, Secretary Sutters announced a partnership between the Commonwealth and the Broad Institute, which is a Harvard-MIT joint venture to help increase testing capacity. The testing at the Broad started yesterday, and we expect to be reporting those numbers along with the other labs that are testing by Friday. The Broad Institute has unique experience in the testing field, and from discussions with them, we expect that they will be able to process as many as 2,000 additional tests a day once they ramp up. All in, we now have 21 labs testing samples here in the Commonwealth. As I've said before, I want to remind people that as we continue to increase the number of tests, we expect to see case numbers rise as well. But more tests means more people know for sure whether they have COVID-19, and from there, those who test positive can work with their healthcare providers and others to take the steps that they and we need to take to limit the spread, and the people they interact with can do the same. This tracing and isolation work is one of the main ways we save lives and reduce the spread. I also want to remind people that if you have questions on whether or not you should be tested, you should begin by contacting your healthcare provider, who will walk you through the steps. We've also increased access to telehealth over the last few weeks, giving more people the ability to connect with their providers remotely. A phone call or a video chat with a trusted clinician is now a covered benefit. Think of it as another form of purposeful social distancing, one that works for patients and for clinicians. Today, our administration is pleased to announce a new effort to ensure the care and safety of the Boston area's homeless population during the COVID-19 outbreak. A former Boston Medical Center hospital called the Newton Pavilion, which is now a state asset, will be temporarily reopened to support the medical needs of area homeless residents. Newton Pavilion, owned by the state, but this new facility will be operated by a consortium of providers, including Boston Medical Center, Boston Healthcare for the Homeless, shelters in the city, including the Pine Street Inn, and the City of Boston's COVID-19 response team. The facility will be used as needed for a range of care needs and potentially treatment for homeless patients. This includes homeless patients who test positive for COVID-19 or are awaiting test results. The facility will provide a safe, isolated place for people to stay and recover if they don't require hospitalization. Acute care for sicker patients, including ICU care, can also be made available. Newton Pavilion will also serve as a post-discharge facility for patients who don't have a home to return to. The whole facility has the capacity for about 250 beds. We certainly view this as a critical step to helping the Commonwealth secure enough space and care for homeless individuals that become infected, and we are grateful to our partners that have made this possible. And over the course of the past several weeks, we've been working with the City of Boston on this issue. They continue to stand up, identify, and staff additional locations to service and support Boston's homeless community. 2 locations opened last week: the Barbara McGinnis House and 112 Southampton Street. The city also announced $2.5 million in grants to strengthen healthcare systems for the homeless population and the city's most vulnerable residents. By next week, Boston expects to open an additional facility for further care options if it's needed. Today, our administration also submitted a request through FEMA to the President for federal disaster assistance in response to the COVID-19 epidemic. This request for a major disaster declaration, if approved, would provide the Commonwealth additional federal assistance beyond what was included in the emergency declaration I announced on March 13th. The major disaster declaration would give support and flexibility to our communities as they respond to the COVID-19 outbreak. This would include a request for FEMA's Public Assistance Program, which would make financial assistance available to cities and towns, state agencies, and certain nonprofits statewide. The disaster declaration also requests FEMA's Individual Assistance Program, including disaster unemployment assistance and crisis counseling assistance to help support our residents. The Disaster Unemployment Assistance Program provides benefits for workers that do not qualify for support through the regular UI program and would mitigate the impact of this disaster on this particular group of workers. We hope to see the feds move on this quickly so that we can get those resources deployed to our residents as soon as possible. From every corner of government, our administration will continue to take swift action to support the health, safety, and financial security of our residents during this unprecedented time. Many of you watching today have been working remotely and spending most of your time in your homes at our request to help us mitigate the spread of COVID-19. I can't tell you how much the Lieutenant Governor and I, and everybody who's part of our administration, appreciates how frustrating and difficult this is for you and your loved ones, but we are so grateful for your continued cooperation and patience. These are uncertain times, for sure, unprecedented, but we're confident that we can get through this together. To all the parents juggling work and kids at home, thank you, thank you, thank you. We know how hard a few days at home with young children can be. From what we hear, so many parents are coming up with great ways to keep kids learning and engaged, which comes, of course, as no surprise. I want to thank you for your patience and your creativity. The people of Massachusetts have always been known for their resiliency and grit during the most challenging times, and this time is no exception. We ask you to please continue to stay informed and use common sense to keep your families and loved ones healthy. You have our commitment that we will keep doing everything we can to ease the burdens of this virus and all of the burden that has been placed on so many across our Commonwealth. And we continue to encourage everyone to subscribe to our new text alert system by texting COVID-MA to 888-777, and we promise we will not overload you with alerts and updates. Continue to get your news from trusted sources and official channels like mass.gov/COVID-19.